Hi guys, it's Sarah Norwood here to continue my functional neurological disorder journey series. It is October 24th, and I have to tell you that I discontinued my group therapy that I was a part of up at the Anschutz Clinic here. Only 1 in 5 therapeutic clinics for functional neurological disorder exist in this country. And what was happening was I was seizing more. I got worse. It was almost as if I would listen to the other women and men that were in this group, and I just identified so much with their pain and their grief and their anger that I would just like take it on. And this was an issue even in my practice, my shamanic soul coaching practice. I'm an empath, so oftentimes when I have empathy and compassion towards others, I tend to feel exactly what they're feeling. And what kept happening was I would start having a seizure during the phone session. We had Zoom sessions every Thursdays, and I would have to leave the actual call because I couldn't stop moving and seizing. So that really was difficult because I was thinking, okay, this is it. This is the one thing. Other than my meditation and my shamanic work with my shaman and stuff, that would actually stop the frequency and duration of my non-epileptic seizures. And when it didn't, and I had to stop it, I tell you, the depression that goes along with this brain disorder, just like a lot of invisible illnesses, the isolation and the depression and anxiety that goes along with it is no joke, because you're talking to somebody that had a healing business for 15 years. I had all my own clients. I worked to help others heal their trauma energy. I felt a purpose. I felt, like, I guess that became part of my identity. So what happens when you get this, when you start having functional neurological symptoms, which can be seizures, paralysis, movement disorders, blindness, brain fog, all sorts of stuff, confusion, it's like everything is stripped away, and you are just left with yourself, nobody to focus all your energy on, because for me, I became disabled. I haven't been able to drive much. I can't go grocery shopping alone because I'll have a seizure. I very rarely leave the house. And so what's left, because I'm unable to help others in the same way, and that was so much a part of my identity and purpose, I'm just left with my own stuff. And I had a bad day this week where, I told my husband, it's like, who am I? What am I doing? Is this it? Is this my life? And I know other FND patients and persons that suffer from this brain disorder feel similar. Any invisible illness, or even any chronic autoimmune illness, anything that's chronic, even anything like cancers and stuff, it's like it has a way of making you so vulnerable and humble, and there's a humility there, and you have to depend on others to help you. And especially if you're a trauma survivor and your trauma response is to push people away when you're in crisis, or have it, some of us have trouble receiving. It has just been really, really hard. And I almost like get jealous of people that are able to be, quote unquote, like living more normal lives. Like you may think, getting up and showering and leaving the house and doing something, or, planning a party or something is like no big deal. Well, for people like us, who, when we never know if we're going to have a seizure, or if we're going to drop to the ground and our legs won't work, or if we won't be able to speak, everything is a big deal. My husband has these Christmas parties coming up for, he's a VP at his company. And all I'm thinking is, do I need bring my cane, my walker? What if I have a seizure? Do I need a hotel room there? Oftentimes when I have a seizure, my legs go out from underneath me and my husband has to throw me over his shoulder and bring me to a safe space to have my convulsive seizure. Is that going to happen in front of people? So, like, for people that are watching this that are just feeling like giving up, please hang in there, because I get it. I am with you. All that I built over the years is gone, meaning like I'm not able to do what I love. I'm not able to help others right now. I don't quite know who I am right now. And I feel lonely, and sometimes I just watch TV all day, or cry, or have an anxiety attack. It is very, very hard. And, please, if you have your health, please have gratitude for it. There's so much to complain about, right? There's so much not to be grateful for, or whatever, with the world the way it is. Please, if you are able to breathe and see and walk and not be in pain, and not have seizures or an illness that is ravishing your body in some way, please just have gratitude for the little things. There's so much beauty and joy. Even me, I go outside and I sit on my swing in the sun, in my PJs with my animals, and I just put my head up to the light and I just say, thank you. Thank you for my family. Thank you that I didn't have a massive stroke where I'm not able to communicate with my family. Because like if that was the case and I wasn't able to express how I'm feeling, I think that would be the worst. So I'm grateful for like the little things, So I'm having a hard time right now, but it's okay. And we all have hard times, and it doesn't mean I'm giving up. Just means like let yourself feel it. Like let yourself have the hard days. You don't need to be positive all the time and everything's going to be great and don't worry. No, if you feel like devastated and everything's been stripped and robbed from you, then feel that. I'm not saying stay there forever and don't come out of that, but dedicate some time during the day to just grieve for what used to be. Because right now I'm disabled, and I'm grieving for the Sarah before my massive seizure started, and before I could speak, when I could speak and walk and talk and not have to worry that something was involuntarily going to happen with my body, when I felt I had a little more control. And what this illness does, this disorder, is it teaches you the lesson of letting go and surrendering and doing things to make yourself feel safe and loved, and letting go of what you can't control. And so much of life is things we can't control. So just find one thing today about yourself and about your little life that you're grateful for, and just let that be enough, and know that you are not alone. Hang in there. Hang in there. I'm with you. Love ya.